If you go to your bathroom and try to check, you would not know because it is not written on that toothbrush. The toothbrush can last a year and it still looks very good, but then it has been causing a lot of damage. Instead of the toothbrush giving way, it's the teeth that actually end up giving way. But when you have held your toothbrush like it's a hammer, nailing a nail on a wall, and that's what you're using to brush your teeth, then you are most likely damaging the teeth. Toothbrushes are categorized hard, medium, and soft. And that writing would normally be there, not on the toothbrush, but on the packaging. That's why if you go to your bathroom and try to check, you would not know because it is not written on that toothbrush. And it's usually something, a very small thing, like now this particular toothbrush here. Right at the corner there, there's something written there. Medium. That means it's the bristles of the toothbrush that are either soft, they are medium, or they are hard. For majority of people, we recommend to use a soft toothbrush. It wears out a little faster, 2-3 months, 2 months even, but you replace it. The hard one will stay forever, but in the process, it abrades or wears away the teeth near the gum, and it pushes the gum up. So you find that we have something we call toothbrush induced abrasion. So the gum has been pushed further and further, and then there are some cavities near the neck of the tooth, V-shaped cavities. We call them tooth abrasion cavities, especially people who are brushing so hard with a hard toothbrush like this. It makes your teeth feel clean, fine, but doing a lot of damage to the gum and doing a lot of. So we recommend a soft toothbrush. And when we also brush, we brush more in a circular motion and with a gentle force. We normally say you use the force, the equivalent force that you use to hold a pen. That's the same force that should be used to brush your teeth. But when you have held your toothbrush like it's a hammer, like forceful nailing a nail on a wall, and that's what you're using to brush your teeth, then you are most likely removing enamel and damaging the teeth.
You spoke on tooth abrasion cavities.
Yes.
I've never heard of that. And do you mind explaining that for people who have no idea what that is?
Yeah, the toothbrush abrasion, it doesn't happen overnight. It's somebody using a medium or a hard toothbrush and using they are very vigorous with their brushing. Near the neck of the tooth, where the gum and the tooth joins around there, the tooth there is a bit softer, the enamel is thinner. So there, or even slightly below the gum, you slowly remove some tooth material and therefore creating a cavity like there. Most of the time they'll be like V-shaped cavity, like there at the neck of the tooth. And it can go all the way deep into the nerves. So people will take it all the way into the nerves with their toothbrush. Yes, and the teeth become very sensitive. The sensitivity don't come because it's a slow, gradual process, so they may not be experiencing it. They start noticing the teeth are now growing, like they are growing longer, but it's because the gum has been pushed far away and destroyed. So that's what we call toothbrush abrasion cavities. The first thing would be awareness and education. Okay, what kind of toothbrush are you using? How much force are you using? Are you brushing back and forth? All those, basically to identify what is the issue so that we kind of try and arrest that. But on top of that, we sometimes may end up doing some small fillings at the neck of the tooth to prevent further abrasion. Actually, today I did some fillings on a patient who came in with toothbrush abrasion on the inside of the mouth, on the palate. So that means they're brushing very, very, very hard. Yeah, not just on the outside, but even on the inside, causing abrasion cavities.